Otoaccoustic emission. Otoaccoustic emission is a sound which is generated from within the ear, though predicted by Thomas Gold in 1948. Its existence was first demonstrated by David Kemp in 1978. And otoacoustic emissions have since been shown to arise through a number of different cellular and mechanical causes within the inner ear. Studies have shown that otoacoustic emissions disappear after the inner ear has been damaged. So OAEs are often used in the lab and the clinic as a measure of inner ear health. There are two types of otoacoustic emissions: spontaneous otoacoustic emissions SOAE, which can occur without external stimulation, and evoked otoacoustic emission, which require an evoking stimulus. Mechanism of occurrence. Otoacoustic emissions are considered to be related to the amplification function of the cochlea. In the absence of external stimulation, the activity of the cochlear amplifier increases, leading to the production of sound. Several lines of evidence suggest that in mammals, outer hair cells are the elements that enhance cochlear sensitivity and frequency selectivity, and hence act as the energy sources for amplification. One theory is that they act to increase the discriminability of signal variations in continuous noise by lowering the masking effect of its cochlear amplification. Types. Spontaneous otoacoustic emissions are sounds that are emitted from the ear without an external stimulation and are measurable with sensitive microphones in the external canal. One spontaneous otoacoustic emission can be detected at least in approximately 30 to 50% of the population. The sounds are frequency stable between 500 Hz and 4500 Hz to have unstable volumes between minus 30 decibel and 10 plus 10 decibel sound pressure levels. The majority of people are unaware of their spontaneous otoacoustic emissions. Portions of 1 to 9%, however, perceive spontaneous otoacoustic emission as an annoying tinnitus. Evoked otoacoustic emissions are currently evoked using three different methodologies. Number 1. Stimulus frequency otoacoustic emissions are measured during the amplification of a pure tone stimulus and are detected by the vectorial differences between the stimulus waveform and the recorded waveform, which consists of the sum of the stimulus and the otoacoustic emission. Again, using the three different methodologies. Number 1, stimulus frequency otoacoustic emission. Number 2, transient evoked otoacoustic emission, TEOAE, are evoked using a click, usually broad frequency range, or a tone burst, which is a brief duration of pure tone stimulus. The evoked response from a click covers the frequency range up to 4 kHz, while a tone burst will elicit a response from the region that has the same frequency as the pure tone. And number 3, distortion product otoacoustic emission, which is DPOAE. They are evoked using a pair of primary tones F1 and F2 with particular intensity, usually either 65 to 55 decibel sound pressure level or 65 for both. The evoked responses from these stimulus occur at frequencies mathematically related to the primary frequencies, with the two most prominent being FDP equal to 2F1 minus F2, the cubic distortion tone most commonly used for hearing screening, because they produce the most robust emission, and FDB equal to F2 minus F1, that is the quadratic distortion tone or simple difference tone. What is the clinical importance? Otoacoustic emissions are clinically important because they are the basis of a simple, non-invasive test for cochlear hearing loss in newborn children, in newborn babies, and in children or adults who are unable or unwilling to cooperate during a conventional hearing test. Many Western countries now have national programs for the universal hearing screening of newborn babies. Newborn hearing screening is a state mandated prior to hospital discharge procedure in the United States. Periodic early childhood hearing screenings programs are also utilizing otoacoustic emission technology. One excellent example has been demonstrated by the Early Childhood Hearing Outreach Initiative at the National Center for Hearing Assessment and Management at the Utah State University, which has helped hundreds of early Head Start programs across the United States implement OAE screening and follow-up practices in those early childhood education settings. The primary screening tool is a test for the presence of a click-evoked otoacoustic emission. Otoacoustic emissions are also assist in differential diagnosis of cochlear and higher level hearing losses. For example, auditory neuropathy. In conjunction with audiometric testing, otoacoustic emission testing can be completed to determine changes in the responses. Studies have found that exposure to noise can cause a decline in otoacoustic emission responses. In conjunction with audiometric testing, OAE testing can be completed to determine changes in the responses. Studies have found that exposure to noise can cause a decline in OAE responses. OAEs are a measurement of the activity of outer hair cells in the cochlea. A noise-induced hearing loss occurs as a result of damage to the outer hair cells in the cochlea. Therefore, the damage or loss of some outer hair cells will likely show up on OAEs before showing up on the audiogram. And studies have shown that for some individuals with normal hearing that have been exposed to excessive sound, fewer, reduced, or no otoacoustic emission can be present. Now, this could be an indication of noise-induced hearing loss before it is seen on an audiogram. In one study, a group of subjects with noise exposure was compared to a group of subjects with normal audiograms and a history of noise exposure, as well as a group of military recruits with no history of noise exposure. They found that an increase in sensitivity of the noise-induced hearing loss resulted in OAEs with a smaller range of emissions and reduced amplitude of emissions. The loss of emissions due to noise exposure was found to occur in mostly the higher frequencies, and it was more prominent in the groups that had noise exposure in compared to the non-exposed group. It is therefore believed that OAEs were more sensitive to identifying noise-induced cochlear damage than pure tone audiometry. In conclusion, the study identified OAEs as a method for helping with detection of early onset of noise-induced hearing loss. It has been found that distortion product otoacoustic emissions DPOAE have provided the most information for detecting hearing loss in higher frequencies when compared to transient evoked otoacoustic emission TEOAE. This is an indication that DPOAE can help with detecting an early onset of noise-induced hearing loss. A study measuring audiometric threshold and DPOAE among individuals in the military showed that there was a decrease in DPOAE after noise exposure, but did not show a shift in audiometric threshold. This supports OAE as predicting early signs of noise damage. The primary purpose of otoacoustic emission tests is to determine cochlear status, specifically hair cell function. This information can be used to, number one, screen hearing, particularly in neonates, infants, or individuals with developmental disabilities. Number two, partially estimate hearing sensitivity within a limited range. 3. Differentiate between the sensory and neural components of sensorineural hearing loss. And 4. Test for functional hearing loss. And this information can be obtained from patients who are sleeping or even comatose because no behavioral response is required. The normal cochlea does not just receive sound. It also produces low-intensity sounds called otoacoustic emissions, and these are produced specifically by the cochlea and most probably by the cochlear outer hair cells as they expand and contract. The presence of cochlear emissions was hypothesized in the 40s on the basis of mathematical models of cochlear non-linearity. However, OAEs could not be measured until the late 70s when extremely sensitive low-noise microphones needed to record these responses became available. The 4 types of otoacoustic emissions are: number 1, spontaneous otoacoustic emissions, sounds emitted without an acoustic stimulus. 2, Transient otoacoustic emissions or transient EOAE sounds emitted in response to an acoustic stimuli of very short duration, usually clicks, but can be tone bursts. 3. Distortion product otoacoustic emissions DPOAE sounds emitted in response to two simultaneous tones of different frequencies. And number 4, sustained frequency otoacoustic emissions SFOAE sounds emitted in response to a continuous tone. Fundamentals about otoacoustic emissions.